Muscular, athletic patients freak doctors out all the time because to them, your labs look like you have liver disease or kidney failure. Keep watching, there's a few things you might have to teach them. But first, let me set the scene. It usually goes something like this. You're at home, unwinding after a long day, or driving home from the gym when your phone rings. It's your doctor on the other end, and he sounds frazzled. He says, your ALT and AST are high, your creatinine is up, your BUN is elevated. This could be hepatitis or fatty liver. It might be kidney damage from high blood pressure or diabetes. Stop taking Tylenol and ibuprofen immediately. You might be in real trouble. Then he starts asking questions. Do you have abdominal pain? Any flank pain? Are you peeing something that looks like iced tea? Have you noticed your skin or eyes turning yellow? And you reply, I don't take Tylenol or ibuprofen. My blood pressure was normal in your office 4 days ago, and always normal when I check it at home. I don't have diabetes. The only medication I take is testosterone. I also take creatine if that matters. And no, nothing really hurts, but my legs are a little sore because I had a pretty hard leg workout yesterday, same as I did the day before my blood draw. This is where context matters. Most doctors are trained to think about labs in terms of the sick, the obese, and the metabolically deranged patient, the majority of people they see every day. In that population, elevated liver enzymes often do mean fatty liver disease or hepatitis. High creatinine might mean kidney damage from uncontrolled hypertension or diabetes. Elevated BUN could point to poor kidney clearance. But if you're lean, muscular, and training hard, those same numbers can mean something completely different. ALT and AST, often considered to just be liver enzymes, not only rise with liver injury, but also with exercise. Heavy training causes microtrauma to muscle fibers, and then enzymes like ALT and AST leak into the bloodstream. Still, medical providers see this and immediately think your liver is in trouble. But if the GGT, gamma-glutamyl transferase, is normal, the source is muscle, not liver. This one test lets your doctor recognize that you probably just crushed a workout, while he's probably thinking you've been crushing 12 packs and destroying your liver. The tricky part is that GGT isn't a routine lab. It's not ordered on a standard panel, so unless the doctor knows to check it as part of a follow-up, they may never see that piece of the puzzle. Creatinine is another one that scares doctors. It's a breakdown product of creatine phosphate in muscle. The more muscle you carry, the higher your baseline creatinine will be. Add creatine supplements to the mix and see an even bigger bump. Throw in a hard training session and creatinine spikes again. To a healthcare provider who doesn't understand athletes, that looks like kidney disease. The better test here is Cystatin C. Unlike creatinine, Cystatin C isn't influenced by muscle mass or creatine use. It gives you a clean read of kidney function, even in muscular patients. But just like GGT, Cystatin C is not a standard part of routine blood work. If you don't ask for it, or your provider doesn't think about it, it's not on the lab slip. Blood urea nitrogen, or BUN, rises for a different reason. If you eat a high-protein diet, your liver produces more urea, and BUN levels increase. If you're dehydrated, even a little bit, that concentration goes up even further. Exercise adds another layer by increasing protein turnover. The result is a high BUN value that alarms your doctor, when in reality it's just a reflection of protein intake and hydration status. Recheck BUN after hydrating, and it almost always looks better. So as you've noticed, hydration plays a huge role in all this. When you're dehydrated, the blood gets concentrated, and many lab values look worse. I just felt my BUN go down. On top of that, intense exercise temporarily reduces blood flow to the kidneys, which can nudge creatinine and BUN upward. Combine those with the enzymes leaking out of your muscle, and suddenly your labs look like a disaster, when it's just normal physiology in the hard training, healthy population the medical professionals just don't deal with all that often. Now let's be clear. Hypertension and diabetes absolutely can cause kidney damage. They are the leading causes of chronic kidney disease. And in a sick, obese, metabolically deranged patient, these abnormal labs often do point to true pathology. But in a lean, athletic patient with normal blood pressure and no diabetes, they don't explain the picture. And just because these elevations are often benign in athletes doesn't mean you should ignore them. If your labs come back abnormal, you should still pay attention. The smart move if this happens to you is to take a few days off of training, make sure you're well hydrated, and then recheck those labs. If they're still abnormal, that's when you clarify with more specific labs like GGT or Cystatin C. And as always, you should be keeping an eye on your blood pressure at home. because even in athletes, that's one of the most important long-term markers of health that gets overlooked. And in case you're wondering where I'm getting all this from, it isn't just my opinion. Studies of endurance athletes show that ALT, AST, creatinine, and BUN all rise after strenuous exercise. These elevations can last for hours or even days, but they don't reflect liver or kidney disease. In those same studies, markers like GGT and Cystatin C stay stable. That's the key. These labs aren't influenced by muscle mass or exercise and prove that the other elevations are just exercise artifact. So here's the takeaway. ALT and AST can go up from hard training and the muscle trauma and recovery cycle that comes with it, not just with liver issues. Creatinine rises with muscle mass, the use of that muscle mass, and with creatine supplementation. BUN is about protein intake and hydration more than kidney function in healthy folks. GGT and Cystatin C are the clarifying tests that separate real disease from the normal variations in standard blood panels seen in hard training athletes. But they're not part of routine lab panels. You have to know when to ask for them. So, not every abnormal lab means disease. Sometimes it just means you lift, you eat protein, or you forgot to hydrate. And if you're muscular and active, that's the conversation you might need to have with your healthcare provider.